Guess what? We are officially living in the Dark Ages. We have two popes and a disease that is sweeping the continents much like the Black Plague. Yes, it's the mysterious coronavirus. Where did it come from? Where is it going? Will we be able to find a cure in time? How dangerous is it truly? Find out everything you need to know in these panic times in the newest episode of Infographics Facts, The Deadly Spread of Coronavirus. Make sure you subscribe to our channel and hit the notifications button below so you don't miss more important information regarding this disease. And watch until the end to find out how we can control the hysteria this virus has caused. It has become common knowledge that this virus has originated from Wuhan, a city of 11 million people in China. Though not confirmed, it may have been through bats, which are eaten in a somewhat readily available dish called bat paste. However, the way it has spread so fast, many people believe it might be some sort of biological weapon. So what exactly is coronavirus? It is actually a family of viruses. According to WHO, previous epidemics, known as SARS and MERS, have also been from the same type of virus. But the pandemic today is caused by a completely new strain, known as COVID-19. It can be transmitted from animals to humans. It basically affects our respiratory system, meaning our air duct, our throat, and our lungs. The signs that you have coronavirus are fever, dry cough, shortness of breath, and difficulty breathing. In severe cases, this might cause pneumonia, kidney failure, and might cause death. However, it is extremely important to remember that 80% of the cases are mild, meaning they do not progress beyond fever and dry cough. The serious cases almost always have underlying problems, or might be over 60 years of age. And even then, with adequate support, our body can overcome this infection. So why is everyone losing their minds? Truth is, the near mass hysteria seems unjustified and justified at times. We have been through some pandemics now, so we know better than to repeat our mistakes and let it spread to everyone. And that's not exactly bad because it is very, very dangerous. It is bad because we do not have the capacity to treat everyone at the same time. If the hospitals are overwhelmed with patients that need ventilators or breathing assistance while their body recovers, then doctors will have to let some patients die. So what we are doing is not preventing everyone getting it. That would be impossible. We are trying to space out the cases so hospitals are not overwhelmed. Therefore, do not be alarmed when you see the numbers rise progressively. That it's actually better than having a surge in cases and then ending the quarantine. Why can't doctors treat it? In this age, nobody actively thought that there might be a virus that modern science couldn't kill. Turns out, it's not easy to make a vaccine out of the blue. And the minimum time for a vaccine to be properly processed and tested is around 12 to 18 months. And with a disease that has a very low mortality rate, like COVID-19, professionals will not risk supplying a vaccine that is not properly tested. With the basic information out of the way, let's explore some myths and how they can be dangerous to everyone. Number 1. Taking a hot bath will kill the virus. This might have worked, have not been for the facts that our body remains the same temperature, which is 37 degrees Celsius or around 97 degrees Fahrenheit. So a hot bath will not kill the virus, but what it will do is A. Damage your skin if it gets too hot, B. Make you think you are cured. Just washing hands and avoid touching the T region of your face should be enough, meaning your nose, your eyes, and mouth. Better not touch your ears too, just in case. Number 2. Virus will die in summer. Unfortunately, scientists don't know for sure how the heat will affect the virus. Certainly, it will slow it down. There might be a surge of cases reported, as right now, people might have gotten coronavirus and recovered, all the while thinking they had the flu. Summer will bring less uncertainty. Number 3. You need a hazmat suit. This one is perhaps the most damaging of the myths. Normal people with good immune systems do not need a bomb suit to go out. They don't need alcohol wipes or other medical equipment like gloves. What they do need is to simply wash their hands frequently and correctly, which is wash during the length of the birthday song twice, not touch their faces, and stay away from a coughing or sneezing person. That's all. These days, the public is having a collective meltdown and buying every medical equipment they could find, but that decreases the supply for people who actually need it. In fact, there are cases of veterinary clinics not having enough alcohol wipes to treat their patients. You want puppies to stay sick? No. Then stop panic buying entire supermarkets. If there are no hand sanitizers available, then try to make some using reputable instructions. Or just wash your hands more. And finally, a bright side, a list of good news, since the media rarely reports these. 1. The mortality rate might be much lower, as many cases of coronavirus are unreported, which brings us to the failure of the government to provide adequate testing, but we will address this issue at the end. 2. It might lead to a better future. Coronavirus is exposing many cracks in our economy, from public schools not being able to shut down as they provide the only meal some students get per day, to the government not being able to adequately quarantine people who are not given enough sick days. It might also reduce carbon dioxide emissions by a quarter, and people may realize travel is not necessary for as many activities as they thought. People with disabilities who were previously denied jobs with the argument that it's impossible to work online in some sectors will be able to realize that corporations can and should accommodate them. And of course, the debate upon free universal healthcare will be opened up with much rigor. $280 is preposterous for anyone to pay for a coronavirus test. And those who are privileged enough to argue against it might experience what happens when your tax dollars go towards unnecessary wars and not universal health care. Hopefully, the elections are positively affected by this event. There you go. All the news you need about the coronavirus. The medical information was taken from the official WHO website, who are urging people to use masks wisely, as to not deprive people who actually need them. As a personal advice, take it seriously, but realize that panic will only create problems for you and others. Make sure you like this video and share it with your friends, family, and coworkers so everyone can be educated about the reality of coronavirus. Subscribe to our channel, as we will be creating important videos as the situation progresses. We will also be holding a contest where we will make a video of your choice if you are the winner picked on Sunday. Just comment your topic in the comments section below and receive your video in 15 days. Don't forget to tune in next time on Infographics Facts. Until then, stay safe.